Hi, everyone, and welcome to the COEE 2021 panel discussion on the impact of COVID-19 on women in racialized communities. My name is Dakshana Vaskara-Murthy, and I'm the race and ethnicity reporter at the Globe and Mail. This topic is an important one to me, and I've spent much of the last year and a half reporting on the unequal impact COVID-19 has had, trying, with much of my coverage, to challenge the theory that we were all in this together. Since March 2020, we've seen the ways in which racialized communities have felt the blows of this pandemic more acutely than the general population. They were infected with COVID-19 at disproportionately high rates because they worked the frontline jobs and lived in the crowded or multi-generational housing that put them at risk. When jobs were lost, many racialized workers struggled to gain their footing again, even as employment figures rebounded. When parents were faced with the difficult decision of sending their kids to school or daycare or keeping them at home, some families didn't have a choice at all because they didn't have the kinds of jobs that would allow them to stay home with their kids, or the language skills or technology to support online learning. And we saw all these struggles amplified at the intersection of race and gender. That's what I want to talk about on today's panel with the three women who are joining me. Leila Sarangi is the Director of Social Action at Family Service Toronto and serves as the National Director of Campaign 2000, End Child and Family Poverty. And sorry, I actually mispronounced her last name there, Leila Sarangi. Anjum Sultana is the National Director of Public Policy and Strategic Communications at YWCA Canada. She's a public affairs strategist and published researcher with scholarly work on gender equity, healthcare, and civic engagement. Anjum holds a Master of Public Health degree from the University of Toronto. Roselle Kim is a staff lawyer with the Women's Legal Education and Action Fund. In her role at LEAF, she contributes to the development and management of LEAF's cases, as well as drafting LEAF's law reform submissions. Roselle's work focuses on substantive gender equality, intersectionality, and technology-facilitated violence. Thank you all so much for joining us. Now, I want to open with talking about the labor of women, especially racialized women, during the pandemic. When COVID-19 hit and many of us transitioned to working from home, there were so many racialized women who didn't have that option, which put them at risk of contracting COVID-19. Tell me about those women and the fields they worked in. Can I start with you, Anjum?
Yeah, absolutely. And I think, we saw that women were on the front lines of this crisis, particularly racialized women, newcomer women, immigrant women. And we saw this across the country from coast to coast to coast. In Canada, 56% of the workforce, women's workforce in Canada, work in something called the 5 Cs. So this includes jobs in cashiering, cleaning, clerical, catering, and also cashiering. So many of those essential occupations that were making all of us survive this pandemic. And I really want to also highlight the impacts around the care economy. When we think about what was saving us in this crisis, what was keeping all of us afloat, it was women in particular, but especially racialized women and newcomer women. And so what we saw, though, is despite the essential labor that they provided, they weren't provided essential protections to the level that we should expect, whether it's things like paid sick leave, whether it's appropriate compensation. We have seen recently a recognition of that essential labor and, provinces and different jurisdictions starting to raise, for example, the minimum wage or raise, that COVID premium, if you will. But in speaking to a lot of folks that have been working in those essential occupations, it seems like it was in this crisis that people actually understood the value of their labor. And there's a hope that this recognition is not going to be short-sighted and just temporary in this current moment, but even after the pandemic subsides, hopefully. That's something that we've been hearing. I also want to share that when we think about the care economy, it's most definitely what we see as quote unquote the healthcare sector, perhaps the educational sector, but we also have to think about nonprofits and charities where over 80% of the workforce are women, and especially at those frontline occupations, it's racialized women. And so in speaking with a lot of folks across the country in the YWCA Federation, whether in our shelter services or childcare services, there was a desire that, absolutely, let's applaud and congratulate the healthcare sector, but let's not forget the rest of society in those essential occupations that are also keeping us afloat. So, this work is essential. And I think one of the pieces that we're hoping for as an organization and in the feminist movement is that this recognition continues well after the pandemic as well.
Layla, what do you think? Do you have the same optimism that Anjum does, that this recognition will continue, post-pandemic?
I don't know if my optimism is quite the same. The one thing I agree with everything that Anjum has said, and to underscore that as the federal government and provincial and municipal governments are coming up with their recovery plans, that the care economy has to be central to that. That's how we're going to recover, and that work does need to be valued. I just add to everything that Anjum has said that there was also, in terms of how the economy shut down, women lost a lot of jobs. So in the, the hotel and the tourism industry, and in the hospitality restaurant industry, that was also precarious labor. A lot of young people, a lot of racialized women lost work there as well. On the one hand, as you saw women being exposed on those essential frontline work, you saw on the other side of the economy, all of those highly feminized work sectors being shut down as well. And then the third piece that I would add to that is the unpaid labor. I think throughout this pandemic, we saw women being absolutely crushed by home care and childcare. We still have that norm in our society, and the research shows that women are taking on a lot more of that unpaid labor than men in the household. And so women were being, pushed into these caregiving roles. And so choosing that and the gender wage gap that widens along lines of race, ethnicity, ability, Indigenous identity. And so women are making less money, and they're making less money if they have those multiple intersections. And so they were choosing to stay home because there were no other options for childcare. And I think that's the whole, that's the conflation of all the pieces, and needs to be taken into consideration as the recovery plans are being developed. And that includes things like, thriving wages and legislated paid sick days, and reformed EI that catches precarious labor and has easier lowered eligibility requirements so that you can get racialized women who are in precarious labor accessing EI reforms. It also would include status upon arrival for migrant women who, if you don't have status and you've come here to work, thinking about live-in caregivers who are living with their employers, who are mostly racialized women who have left their own kids at home to try and find opportunity here, who have no access to, health and labor protections, and that's compounded by immigration laws. So those pieces need to be addressed.
I think there was a perception too that when our country went into lockdown last March, that things would be calmer and quieter because so many of us were home, that there would be less violence, less crime. But the Toronto Foundation reported in May 2020 that in the first wave of the pandemic, calls to the Assaulted Women's Helpline were up 75%, and 73% of those callers were racialized women. Let's talk about what was happening there. Do you want to get us started, Roselle?
Sure, thank you. So before we start talking about the increased risk of intimate partner and domestic violence, I'll just say that I'm joining you today from Takarancho, also known as Toronto, the traditional home to the Wendat, Anishinaabe, the Haudenosaunee, and Mississaugas of the Credit. And of course, just to situate that, talking about the violence, we have to acknowledge the colonial violence and the legacy that we are still reckoning with. So yeah, I think that as we went into lockdown, as you said, there was a perception that perhaps times would be calmer. And of course, what happened shows that home is not a safe place for everyone. And I think that for folks experiencing abuse and violence from their partner at home, stay-at-home orders really exacerbated the harms that they were experiencing for a couple of reasons. First, they're exposed to more of the abusive and violent situation because everyone's at home. And the second, the economic and social precarity that we just talked about, that their partners may be facing as well, then it could result in increased abuse and violence. And that was also coupled with some of the service providers, a lot of the service providers, switching their practices to being virtual or phone only, which then poses difficulty if for you, home is not a safe place and it's not a private place necessarily. And I'll just say from a legal perspective, COVID-19 also exacerbated a lot of procedural barriers in the justice system. And, these kinds of access to justice issues were already present before COVID, and they were made much worse for a couple of reasons. And one is that a lot of the courts early on in the pandemic limited hearings to matters that they deemed urgent. And, so then that kind of posed some additional hurdles to show that your matter was actually urgent on top of an already backlogged court system. And of course, hearings in the courts became remote as well, which addressed certain barriers like travel, but then made it a bit worse for people who don't have regular access to technology or aren't very familiar with them or have linguistic barriers like a lot of racialized women. So I think I'll just end there as an overview of why intimate partner violence and domestic violence increased so much.
Go ahead, Layla.
Thank you. Yeah, I just want to add to that. I want to be really clear that those statistics, even as high and shocking as they are, I just want to be really clear that it doesn't mean racialized men or racialized people are inherently more violent, and that racialized women are inherently more victimized. I think in the systemic context, what we're looking at are, with people who are racialized newcomers that are experiencing those barriers like linguistic, or they might not have access to, the resources, community support, other kinds of, that kind of social infrastructure that other people may have. And that's what drives up these calls. And also just to add that calls to kids helpful. I work on a child poverty campaign, and that's the kind of perspective I'm bringing here, but calls to the kids help phone were also exceptionally high. I think in the same kinds of numbers, around 70-80% increase to kids help phone in the early pandemic. It was those kids who were being also trapped at home with their abusers. And then because schools and community centers were closed down, they lost those places where there would have been intervention. And then now, and I think Anjum can probably speak a lot more to this, but the mental health piece and the kind of that ongoing strain on youth and kids about being, at that developmental stage and age and being locked down for so long.
Yeah, and if I may share a couple of pieces I want to pick up on is also around other forms of gender-based violence that we've actually seen increase in the pandemic. And one of that is hate crimes. We've seen, for example, a rise in gendered Islamophobia. We've seen many, many cases, for example, of visibly Muslim young Black women experiencing more and more hate crimes in person, online, and Roselle may also share a bit more about that as well. But really to talk about, all the different aspects and forms of gender-based violence, they've increased. And we've seen that especially with respect to hate crimes, for example. And that's something that we as a society really need to think about as we think about recovery. Is it enough for us to have an economic recovery if jobs are back to pre-COVID levels and we've, addressed some of the economic strains? If we're not also addressing the shadow pandemic and all these other forms of gender-based violence. For us, I would say, for me, that is not an inclusive inclusive recovery if we don't address, the climate of hate, fear, and violence. And then just picking up on what Layla said around young people and young women and gender diverse youth in particular, racialized folks, I was also looking at some of that mental health data where we saw after increases of consciousness around systemic racism, we've also seen, this anxiety, how do we actually address systemic racism? And young people are wondering, what does that look like? What kind of society can we build? And, the mental health implications of that. And also we're seeing racialized young people also trying to understand, how do we do bystander intervention? How do we perform allyship? What is our role in this as well? So also, I think there's a space for all of us to contribute to that conversation as well.
I can add, just picking up on the hate crimes part, and and it's a really important thing to recognize. And talking about hate crimes and bystander intervention also brings into focus the criminal justice system and policing, and recognizing that the law can have this role in acknowledging something terrible has happened, and maybe being used as a tool for recognition, maybe retribution. But the law has also been a tool for violence that is being perpetuated against Black and Indigenous people and racialized people. And something like criminal law is a really blunt tool that has historically targeted racialized communities, especially Black and Indigenous communities. So I think when we talk about the recovery and how we seek justice, there is a need to also recognize that the existing system is not doing a great job at recognizing them, especially when the victim is a woman, is racialized, is Black and Indigenous. So
I think that's a great jumping off point, Roselle, into the next topic that I wanted to discuss with all of you. So, we saw some pretty disturbing scenes this summer and fall at some encampments across Canada where unhoused people were very violently removed from the places that had been temporary homes to them for sometimes weeks or months. And, despite temporary rent freezes and eviction bans in many jurisdictions, a lot of people fell behind on rent or lost their homes in the last year and a half. In October, when Prime Minister Justin Trudeau shuffled his cabinet, Ahmed Hussein was named Minister of Housing and Minister of Diversity and Inclusion. What's the significance of having him oversee those two portfolios, Anjum?
Yeah, this is such a great question. And I'm really interested in how this combination of portfolios will start to speak and inform one another. One of the things we've heard a lot about, and it's actually increased in the pandemic, is this idea of housing discrimination. We've heard of countless stories, and the data is starting to come out around this, around discrimination, around actually getting rental agreements, having access to affordable housing. We've seen, for example, we have a number of YWCAs across the country, many that operate in tourism centers, for example, in Banff. And we've seen, the precarious nature of housing and work being intertwined, and how challenging it is, for example, for newcomers to access housing. Sometimes, to access housing, you need to have a credit score check. And if you haven't been in the country for a long time, how do you build that credit score? How do you actually, engage in the housing market? So I think, this is just one example. There's several, but really thinking about how do different issues impact different communities, and ensuring that we don't use a one-size-fits-all approach, and also recognizing and building in equity into our policy prescriptions. The federal government, after a very long time, came back to the table around housing. We have a national housing strategy. One of the things that we had been pushing for is a recognition that housing, for example, and homelessness looks different for women, looks different for racialized women. So how do we actually ensure that money is targeted to different communities? So one of the things we pushed for was around a carve out of the national housing strategy through a gender lens. But I would say we need to also do that for diverse communities and at that intersection. And I think right now, there's still, this challenge to look at the complexity of issues. We sometimes look at, okay, how does this issue impact women? How does this issue impact racialized folks? But not really looking at perhaps the intersection. So I'm hoping that, having a minister who's also responsible for housing and diversity and inclusion, these conversations will start to inform each other. Because I think if we don't, we're not going to have the results that we're seeking. And I think if we really want to create those equitable outcomes, we need to do it at the beginning stages as we're setting policies, as we're thinking about programs.
Thanks. Layla, Roselle, do either of you want to chime in with any thoughts on housing and the way that we talk about housing? I mean, we had a federal election just a couple of months ago. Housing was the dominant issue during that federal election, but so much of it is framed around home ownership. Who are the people that are being left out of, these broader discussions on housing affordability?
Yeah, I think that's a great question. And Anjum, I was interested about how you described women's homelessness when you said it looks different. But one of the things that I think the movement, the feminist movement and the women's shelter movement is saying, actually women's homelessness is hidden. So when we have these programs like Housing First, which was a model that was trying to get people who were street involved, chronically homeless, and that definition is living on the streets for 6 months or in a shelter for 6 months plus, then you get priority access to an apartment unit. And I think it failed for a few different reasons, but one, it failed women in particular and gender diverse folks because their homelessness looks different and it's not visible. It's not street involved for that kind of period of time because they're more subject to particular forms of gender-based violence on the street. So what happens often is that the women we talked about earlier who are at home with their abusers, that's hidden homelessness. The women who are in unsafe environments, living with landlords who are abusing them or, trading sex for a roof over their head, who are couch surfing with their kids because they don't want children's aid involvement. That is all women's homelessness. And so we're hopeful at Campaign 2000 that the new Minister of Housing, Minister Hussain, will bring that recognition through that diversity lens and redefine what chronic homelessness is. And I think, you asked about like the middle class and how do we ensure that people who are lower incomes part of this, the solution building. And I'll say to that, the National Housing Strategy did something pretty significant when it put into writing and then into legislation that the right to housing, the right to adequate housing is something that everybody has the right to. So also bringing that framework. So they did that. It's been almost 5 years since the National Housing Strategy was released. And so it's up for a review. And so hopefully the minister having that diversity portfolio will do a review through that framework of, are we furthering the intersectional gender-based plus commitments in that strategy? Are we making sure that, or are they making sure that every dollar that's funded, every program that gets built through that strategy is also targeted towards people who are multiply marginalized? That's much harder work to do, but it's got to get done. And then those structures, those mechanisms that are put in place to realize that right to housing, making sure that they are well resourced, that people can access them. So we're still waiting on the appointment of the National Housing Advocate. I'm hoping that that's going to be one of the first things that the minister does, so that where there are failures in the system, people have that legislative recourse.
I'll just add a couple of quick thoughts. And I think the encampment evictions that you referenced, Dakshana, it shows how poverty is criminalized. And we have talked a lot about how poverty is also racialized and feminized. So, the response to the widening gap in economic security has to be grounded in providing support and not punishing folks for being poor. And I think what we're also talking about here is that we can't have a one size fits all solution, and that includes safety as well. So I think what we really need to ask is, what does safety look like to folks? And maybe it is going to shelter, and maybe it is not. Maybe it's living in an encampment. And I think it's, respecting people's agency to make choices for themselves to be safe, and honoring that.
And Roselle, there's actually one more thing I wanted to talk to you about on this subject. We were discussing the way the justice system, many parts of the justice system, moved online during this pandemic. And we saw this happen with a lot of landlord and tenant board meetings. And tell me about, what the challenges were for, people who were at risk of losing their homes, having to dial into a hearing that way, and how that was different from, the pre-pandemic system that they operated in.
Yeah, so I actually don't do a lot of housing work, so I don't know if I can answer this really fully. I know there are a lot of groups in Toronto and also nationwide that are doing housing rights work and tenants' rights work, but I do know that the tenant board hearings moving online has posed a lot of difficulties for folks who don't have regular access to the internet and technology, and that's definitely adding to the access to justice issue. And I think there are consequences to you not showing up to your own hearing, and that also just seems like being punished for something that you do not have the means to do. So I think that's definitely something to keep in mind for sure.
I want to switch over now to talking a bit about the so-called social safety net. So Statistics Canada published a report that looked at the first year of job losses in the pandemic and found that women accounted for 53.7% of year-over-year losses. The federal government rolled out several relief programs, including the Canadian Emergency Response Benefit, to address the economic impact of the pandemic. But these programs left a lot of women out. Can you tell me about that, Leila?
Yes, sure. So I think when we look at the data, for example, like of who access the Canadian Emergency Response Benefit, I think there's no real gender implications, which is different than when you look at, for example, the way employment insurance works, where you can see women who are working those precarious jobs we talked about earlier don't qualify. The federal government did move really quickly at the beginning of the pandemic to get that Canadian Emergency Response Benefit to individuals as one of the largest programs that they invested in. And that was interesting because, they moved very quickly. It was a low barrier program in that, simple attestation. You go online, you say, yes, I've lost work because of the pandemic. And 2 days later, you get $2,000 in your bank account. It was problematic in its design, and it did leave people out. So there was a qualifying threshold. You needed to have earned $5,000 in the last year. And then there was this, what we call an eligibility cliff. So if you earned $1 less than that, $4,999 or anything below that, you were not eligible for any amount of the emergency response benefit. And we know from what we just talked about that that's a lot of racialized women working those precarious, not full-time work left out of that. You had to have documentation. So people whose social insurance numbers had expired and the offices were closed and they couldn't renew were not eligible. You had to have a bank account. You had to have a CRA account. All of these things, rendered you ineligible for the benefit. For people who did get the benefit, who were low income and, for example, on social assistance programs, that benefit was then clawed back. And the money, that federal government money, went into the coffers of provincial and territorial governments, and it was treated differently across jurisdictions. In some jurisdictions, there was 100% clawback. In some jurisdictions, there was a partial clawback. In some jurisdictions, very few people were able to keep the full $2,000. So it was treated very differently. And it also, if you were on a rent subsidy, that was considered, these benefits were considered earned income. So the social assistance programs and the rent subsidy programs that get calculated on a monthly basis, they look at how much money you make, and then they do readjustments. So rent subsidies went down, meaning people had to pay more rent. And a lot of times these were people who already had experience of social assistance clawback. So there is this kind of triple whammy happening. And then on top of that, the federal government came back and said, in the beginning, their narrative was, we're leaving nobody behind. Just apply if you think you're eligible. CRA staff were saying that. People in places like our organizations, frontline workers were saying you apply because the government's saying leave no one behind. And social assistance legislation says people have to exhaust all of their potential sources of income and liquidate all of their assets. So they're legislated to apply to see if they could get the CERB, and then they did. And then in December last year, the federal government came back and said, well, you might not have been eligible, and they spent $1 million sending letters to people, mostly who were low-income individuals, saying, give us more information about your eligibility, or you'll have to pay back these thousands and thousands of dollars that were spent on, what people were supposed to be doing. That's staying at home safe, stocking up on groceries, buying PPE, buying sanitizers, paying for more internet access so your kids can socialize and school online, I'm a single mother. I have 3 kids at home. The amount of equipment, technology equipment I had to purchase, and thankfully I could, but for those low-income families, that money is no longer there. And now they're being saddled with a federal debt. So, and the lessons learned from the Canadian Emergency Response Benefit, which ended in October 2020 and turned into the Canada Recovery Benefit, those lessons weren't applied. So it had the same eligibility criteria. So what we saw with the Canadian Emergency Response Benefit at tax time was a recalculating of other benefits, like and people have probably been reading in the paper because it's a very live issue, how seniors, the lowest income seniors making less than $20,000 a year, have lost their guaranteed income supplement because they received the CERB and it brought them over the threshold. And so their guaranteed income supplement was reduced and in many cases eliminated altogether. We're now hearing reports just over the weekend about the same recalculations and loss of benefits for parents on their Canada Child benefits. So low-income parents are losing out on the Canada Child benefit. And this recovery benefit, the Canadian Recovery Benefit, went from October last year. It ended on October 23rd of this year. So now these low-income workers, these precarious workers, in the midst of 4th wave pandemic, in many jurisdictions that are still, have dangerously high COVID variants rampaging through communities with an economic recovery that's extremely precarious. There are no benefits. There's no income benefits anymore. It ended on October 23rd. But these clawbacks are going to continue happening because people are going to file their taxes again in the new year. And all the CRB, the CERB, and the CRB that they collected in this past year is going to again impact. And we've been asking the federal government, are you sending these letters out? Are you going to be asking people to repay again after the money's been clawed back or spent on necessities? This is a massive problem for those who are the lowest income earners in our community. And I'll just say there was nothing for people who weren't workers. So those social assistance recipients who earn less than half of what the CERB is at $2,000, a single person on social assistance where I'm at in Ontario, it's about $730 a month. There was no benefits for no increasing of rates for any social assistance program across the country. So those are the folks who've been, really left out of any pandemic response, emergency, or recovery.
I want to talk more about that in a second, but I just want to let all of the people tuning in know that, they can submit questions to our panelists. We're about halfway through this discussion, so feel free to submit your questions and maybe we'll get a chance to spark some more discussion. I wanted to ask this of all of you. What do you think a more inclusive equitable and progressive benefit program would have looked like in Canada. If it had been by your design last spring, what would you have wanted to put forward in Canada?
So I know a lot of people are talking about a basic income, right? This idea of getting the $2,000 a month through the Canada Emergency Response Benefit has had a renewed that idea of a national basic income and what that could be. I think it's also a divisive argument because there's not a lot of agreement on what it should look like, who should get it. Is it universal? Does it go to everybody? Is it means tested? How does it get administered? Is it possible? There's so many details that need to get figured out. I think the bottom line is that benefit programs need to work together to bring family incomes, individual incomes up to, at the very basic, a low income measure, but ideally a thriving wage, not even a thriving wage, because there is a dignity piece here. We're not talking about, just getting your basic needs met, which is what the federal government defines as poverty, is just about getting, paying your rent, paying your food, paying your clothing, and then you don't have a quality of life. You're just so we're not talking about that. We're talking about dignity. We're talking about health and wellness. And so an income security program that removes barriers. I'll say, for example, one of the campaigns that we're working on right now, there's a charter challenge against the federal government. The Canada Child Benefit is not accessible for people with precarious immigration status. These families are considered residents through the Income Tax Act. So they're here, they're working, they're waiting for their hearing, or they're waiting to be deported, but Canada said their home country is too unsafe, so they don't know where to send them. But they're here, they're working. Many are working these low-wage, precarious jobs. They're paying into the tax system. They're paying their taxes because they are residents for income tax purposes, but immigration considers them non-residents, so they can't access the Canada Child Benefit. So making sure that those systemic barriers are removed and all families can access those programs is one piece. For us, the other piece is making sure that there's a way to get income to families who are outside of the tax system. Not everybody files their taxes. About 76% of the population does, but many don't. And those are people who have multiple barriers, who are houseless, underbanked, precarious. First Nations communities have a different relationship, so they're not, there's a lower take-up rate there. And so making sure that women, we heard a lot from sex workers over the pandemic and migrant workers who weren't able to access the benefit. So a way to work with communities and charities on the ground to get benefits to those who are outside of the income tax system. And none of this can be at the expense of creating that decent work. So there's a little bit of a misperception, and we've heard this as the Canadian Response Benefit was being dissolved, that it was holding people back from taking jobs. But actually, the root cause is that these jobs are poverty jobs, right? And they're really unsafe and there are no labor protections. That's the thing that needs to be fixed. And so we need a robust income security program, but we also need to be creating decent jobs. And Campaign 2000 does, advocate for a full jobs program, a full jobs guarantee, where this is about creating really decent work that builds on your skill sets, that benefits the community, and that is available, and then gives these employers or gives people an alternative to those kinds of really poor jobs.
Yeah, and if I may share 2 points as well, just around, I agree with everything that Layla has said. I think, touching on a topic that Layla mentioned around dignity, I think what we've seen is that, it is important to have income security, but it's also very, very important to have the benefits to have a good life. And I think an area that we have seen conversations dampened, but we need to see that acceleration, is around all the other aspects of our healthcare system that are unfinished, whether it's access to dental care, whether it's access to pharmacare. We know even pre-pandemic, people had to choose between rent and food on the table and actually getting access to prescription medications for them to be healthy and well. This type of choice should be something we need to, this false choice that is given to people, that's something we need to address. And I think, talking with policy advocates who've been working in, social protections and many different social policy issues for the last 30 years, they said in this pandemic, the policy window that opened up, the amount of change that happened over 30 days, over 3 months, folks have not seen that change, that pace of change over, some issues over 30 years, right? So when people say it's not possible, I think this pandemic has given us a proof point that it is possible to change things, to prioritize the needs of marginalized communities if we make it a priority, if we build the political will, if we create the collaborations and coalitions to make that conversation continue to be on the airwaves and in our newspapers. And I think, in addition to all the other things that we need to support a good life, we also need to think about, for folks who are experiencing multiple instances of marginalization, how do we support people and them getting their entitlements? Nonprofits and charities have been working overtime to ensure that, as different entitlement programs were coming out, that the people that they serve are able to access. And Leila mentioned, and Rosella as well, some of the systemic barriers that prevent people from getting access to programs they are eligible for. I think what we need to also do is invest in organizations like nonprofits and charities who support and accompany people in that challenging and sometimes confusing process of actually accessing those entitlements. So I think, we saw so many people access these programs, but it was challenging for them. And I think what we can see is that there's importance in having that accompaniment approach that many nonprofits and charities specialize in. And I think that also needs to be part of what we think about when we think about a social safety net, is also investing in the organizations that are there with communities.
I'll just add quickly that LEAF has been trying to grapple with this question of, is basic income good for gender equality? And my colleague C. Strauss and another researcher, Sally Kimpson, just released a report on basic income and gender equality, one on basic income and women with disabilities, and the other one on basic income in the care economy, where the recommendation was that LEAF does support an implementation of a basic income program, but only with other necessary policies and commitments, relating to what folks have already talked about here. So they include committing to strong labor protections, high quality jobs, accessible public service, pathways to permanent residency, and access to high quality, affordable childcare. So I think we want income support, but also we don't want the income support to be an excuse to eliminate social services.
We have been experiencing in this country a declining birth rate, and the federal government's sort of biggest solution to that is very ambitious immigration targets. We know that this year the target is bringing in more than 400,000 new immigrants, and there are targets for the next many years ahead that steadily increase. What do you all think the federal government needs to be mindful of before continuing full steam ahead with bringing so many newcomers to Canada?
I think one area I'd love to point to, and we're seeing with respect to immigration, it is folks who are coming into the country from many parts of the world. Many of the folks who are coming in are racialized communities, Black community members, and we need to ensure that that idea of the Canadian dream is actually accessible to all. We have, federally employment equity legislation. Right now, the way it's defined, one of the protected groups is visible minorities. First, I think we need to also change up our language to ensure that it's actually reflective of some of the changes we've seen in language around Black, Indigenous, and racialized communities. And that legislation looks at federally regulated workplaces and ensuring that there's equity in the workplace in terms of advancement, promotions, recruitment, et cetera. I think we need to also see similar legislation at a provincial level for provincially regulated workplaces. But I think over and over, what we've seen, and the data demonstrates this, is that newcomers to Canada are becoming more and more advanced in their education, have high, significant credentials, but when they arrive in Canada, there's no pathway to a good job. And many folks are being, in some ways, streamed into low income, precarious, temporary work. And there is this feeling, emotionally, that, there's this idea of Canada, but when people arrive, what is actually presented to them in terms of access to a good life? And I think that's something we really need to address. And just thinking about it from a competitive advantage, as we're thinking about, talent, and we're thinking about how do we make Canada an attractive country, we also need to think about, newcomers talk to each other. They're seeing what is possible and where there's opportunities and where there's this false narrative or this false dream. And I think we need to address that as a country. I think, one of the ways we can do that is investing in our social safety net, or investing in our public programs. I know many folks are starting to look at Canada's childcare program and, this idea of a nationwide early learning and childcare system, and putting that into consideration as they think about where they want to move, where they want to immigrate. So I think, for us, or one of the things I would encourage and would like to see is investing in the programs that make our communities and country strong. That is one of the ways to ensure that we not only are welcoming people into our country, but also ensuring that they feel good about their life outcomes and future prospects in the country as well.
I think having something I mentioned earlier, but just, guaranteeing status for them in ways that are not tied to their employment, and that will sort of prevent them from having precarious or no status, will be important, because I think we've seen how having that precarious status really impacts your status of life. It prevents you accessing the justice system because you're afraid of being deported. And, we've also heard from caregivers about how they lived in extremely exploitative conditions because of their status, and their employers sort of taking advantage of that. And I think from a justice system perspective, there really needs to be more investment in the justice system. Legal aid in Ontario has been chronically underfunded since the 90s. And, they set up these administrative tribunals, including the Human Rights Tribunal, which were set up because the courts were so backlogged, as a way to quickly access human rights remedies. But those have also been sort of underfunded to a point where I think you have to wait about a year or two to get a hearing. So there really is no way to get a speedy hearing right now, and that really needs to be addressed.
Great. Oh, go ahead, Leila.
I would just add a piece around family reunification. I think Anja mentioned access to childcare. I think, a lot of people who come in, we're talking about skilled immigrants, right? Who are coming in through that point system, who may have job offers here, that kind of thing. But many of them also want to bring their families with them. And a lot of them are, coming, they want their grandparents to come, they help with the childcare. But then they can't access things like the guaranteed income supplement or the old age security program, because they haven't had the number of years of residency. But because these individuals who are coming are being driven into these low wage, precarious work, it's a lot of pressure on them because they've agreed to be responsible for the family. So we hear stories from our members who work with, in these communities around that kind of financial precarity that then people find themselves in. On the one hand, as federal governments, pick up on all the strategies that Rizal and Anjum have talked about, I think too, we need on a parallel hand to make sure that we're also, through our immigration system, providing support and access through our refugee process as well. I think that's kind of a parallel thing that's happening, but I don't think we have time to go into those kinds of connections, but I think that's another thing that we need to consider. And so as we build out a system that is friendly to migrants, that we're kind of have that bigger picture.
Great. Now, even in some of the good news stories of the last year and a half, like the approval of the COVID-19 vaccine, we saw slower rates of vaccination in some racialized populations. And I want to talk to all of you about some of the factors that contributed to that and some of the misconceptions that the greater public might have had about why there was slower uptake, why there was some vaccine hesitancy in racialized populations.
Yeah, if I can share, I had the good fortune of volunteering actually at a vaccine clinic, and it was in a part of the city that has a high percentage of racialized communities. And that line went around the block. People were waiting for hours so they could get access to vaccines. So I think really, disrupting that narrative that perhaps racialized communities are not willing or interested in the vaccine, it could be actually around not necessarily vaccine hesitancy, but vaccine access. So I think that's something first and foremost to really think about is, are the current ways that vaccine distributions, especially earlier on when that distribution was happening, were they actually done so in an equitable manner? Were there enough resources put against it? Were there enough staff that were able to be paid to ensure that operating all those different types of vaccine clinics? And also, and Layla has mentioned this before, and Rosella as well, ensuring that there's wraparound supports, ensuring that there's linguistic access. So these are all the different ways to ensure that there's actually vaccine access. And it may actually address perhaps what people may have initially thought of as vaccine hesitancy. But I would be remiss if I didn't talk about, historically marginalized communities have a legitimate fear of, medical systems that historically in the past have created issues like forced sterilization, forced, experimentation. We saw, for example, in this country over the last number of months, greater increased awareness of what happened in residential schools and some of the things that happened there around medical experimentation, for example. And so I think, one of the things that some of our YWCAs have been looking at is actually understanding why different communities may be hesitant because of this historical instances of systemic racism, and actually having honest conversations about that, and also ensuring that people are able to speak to healthcare practitioners from their own communities about these hesitations, about these challenges in getting the vaccine. And I think that's a way of ensuring a compassionate, culturally safe way of ensuring vaccine access. And so, yeah, those are some of the things that we've been thinking about. And I think we need to also be thinking about in the broader narrative around racialized communities and other equity-seeking communities and vaccine access.
And I'll just make another quick plug for legislated paid sick days, because we saw when the recovery benefits were implemented, there was a 2-week sickness benefit as part of that package that people could access, but you had to take the full 2 weeks as that packet, as part of that benefit. And that was so, people could isolate at home or care for somebody who's isolating at home. But to Anjum's point, like those who just needed the day off to get to the clinic, who are working those low wages, who couldn't afford to take the hit to the paycheck, they didn't have anything. And I, again, am in Ontario, and how long did it take before we got those 3 sick days, right? I think it was well over a year into the pandemic before that came into place. So that, I think I understood that to be one of the big reasons why folks who are working in those, like Amazon warehouses and factories and on farms and, who weren't vaccine hesitant, just had no choice, no way to get there that wasn't going to really have a financial impact. And then also some of those places like migrant workers on the farms, we've seen lots of documentation about how those employers were not promoting vaccines, right? That they weren't allowing that. They were forcing migrants to work. Even when they were sick, they weren't provided any kinds of protections. And we saw deaths happen because of that. We saw that in, factories where migrants were in very crowded work situations and, COVID outbreaks, and again, deaths as a result of that. And that the narrative gets put onto individual racialized people to say, well, you're hesitant, like the onus is there, but it's actually not. It's on the system, and it's on those bad employers, and it's on the government to not intervene and provide that access appropriately.
Well, on that note of, just the way people who hadn't been vaccinated were perceived. I mean, so much of that, and I say this as a journalist myself, I think can be carried by mainstream media. We had wall-to-wall coverage of COVID-19 news for the last, almost 2 years now. And I want to ask, what were some of the big mistakes that you saw mainstream media making in the way that they were reporting on the pandemic, on the way they were reporting or perhaps not reporting well enough on racialized communities, racialized women?
I think, and I'm hoping that this will shift with the pandemic. I'm very curious about what the legacies of this pandemic will be across different sectors and, professions, et cetera. But, in the beginning, especially, a lot of coverage was on the symptoms of bad policies, the symptoms of barriers. And, we're seeing this phenomenon in this community. But I think what we need to encourage all of us in every single sector, and we mentioned, for example, the media, is actually start to address and interrogate the root causes. Why is something happening? And not just asking the first why, but going deeper and deeper. And I think, what we've seen in this pandemic is a recognition that the social determinants of health is what has been saving us in this crisis and will also be, helpful for the recovery. But it's also the answer for a lot of inequities in our society. Part of the reason why we see different outcomes for different populations is because not everyone's starting on the same playing field. Not everyone has access to all of the same resources in the same manner, without those systemic barriers. So I think that would be my hope, is that as we move beyond, and we're still in this pandemic, especially across the country, but as we start to think about recovery, we actually encourage all sectors, but especially also media, to talk about not just the symptoms of issues, but the root causes of issues, because I think that's at the heart of the matter, and that's where our solutions will be. And it's important that there is this literacy among the broader population about what do we actually need to have a good life, and perhaps we need to start to look at the root causes of issues.
I think adding to that, I did see, I feel like there was some coverage about this kind of fear of providing benefits to people, and will it make people lazy? Will it people not go back to work? And I think that kind of framing, like Anjum said, is not getting to the root causes, which is, a lot of jobs were low wage, and they would, they're not a lot of workers don't have a living wage, especially in places like Toronto or Vancouver. So, instead of framing the issue as the benefits being a problem, maybe it was our workplace conditions, lack of labor protections, lack of unions, those. I think just getting more to the systemic issues and talking about the benefits and how people did benefit from those supports, as lacking as they were, would have been helpful.
And I would just say that, we've talked a lot about the systems, right? And the systems in place. And so what I think about is all the racialized journalists who were saying, we're trying to put these good stories forward. And the editors were like, nope. Dakshan, I think you've done such a fantastic job of that. And it's great that you were supported by your organization or your paper to be able to do that. But I remember, reading many stories by many different people who then ended up leaving the field or their paper and then working elsewhere. So I think mainstream media, the people who are running mainstream media, have a responsibility to make sure that stories are exposing those root causes, that they're going beyond the soundbite, that they're invested in telling what may be, those kinds of stories that are really digging deep and putting resources and supporting their journalists to do that really, really important work. And that's not just limited to journalism. I think it's also policy, right? And policy makers are doing the same kinds of things. And I think so taking those stories from those individual experiences and placing value on them. To me, this is a values-based question. What are we valuing? Who are we valuing? And that's a question that I think is going to be really essential as we go into recovery, right? Like when we recover and we get back to, whatever the new normal is going to be, what's going to be the value? How are we centering the care economy? How are we making sure that highly vulnerable people who are made vulnerable by our systems are not falling through the cracks? And yeah, journalists and newspapers and mainstream media have a responsibility to, help us at the policy side kind of push some of those stories forward and expose them, I guess.
Thank you. And we are just about out of time for today. I want to thank Roselle, Leila, and Anjum so much for their smart insights today, for this great discussion. Thank you all, and I hope you'll stay tuned for other sessions in today's program. Thanks, everyone.